Let us learn about government programs in childcare. Introduction. Child rights are integral for the development of children. In order to ensure these entitlements to children and to fulfill international commitments, the Government of India, along with civil society, has made efforts by introducing various policies and programs. These initiatives aim to nurture the childhood of children, providing them basic rights of survival, protection, development, and participation. Integrated Child Development Services ICDS scheme. It was launched on 2nd October 1975. The Integrated Child Development Services ICDS scheme is one of the flagship programs of the Government of India and represents one of the world's largest and unique programs for early childhood care and development. It is the foremost symbol of country's commitment to its children and nursing mothers as a response to the challenge of providing preschool non-formal education on one hand and breaking the vicious cycle of malnutrition, morbidity, reduced learning capacity, and mortality on the other. The beneficiaries under the scheme are children in the age group of 0 to 6 years, pregnant women, and lactating mothers. Objectives of the scheme are to improve the nutritional and health status of children in the age group 0 to 6 years, to lay the foundation for proper psychological, physical, and social development of the child, to achieve effective coordination of policy and implementation amongst the various departments to promote child development, and to enhance the capability of the mother to look after the normal health and nutritional needs of the child through proper nutrition and health education. Services under ICDS: supplementary nutrition, preschool non-formal education, referral services, nutrition and health education, immunization, health checkup. The last three services are related to health and are provided by Ministry or Department of Health and Family Welfare through NRHM and Health System. National Crèche Scheme. National Crèche Scheme, earlier named as Rajiv Gandhi National Crèche Scheme, is being implemented as a centrally sponsored scheme to provide daycare facilities to children of age group of 6 months to 6 years of working mothers. The salient features of the National Crèche Scheme are as follows: daycare facilities including sleeping facilities, early stimulation for children below 3 years, and preschool education for 3 to 6 years old children, supplementary nutrition, growth monitoring, health checkup, and immunization. Sarva Shiksha Abhiyan SSA is an effort to universalize elementary education by community ownership of the school system. It is a response to the demand for quality basic education all over the country. This program is also an attempt to provide an opportunity for improving human capabilities to all children through provision of community-owned quality education in a mission mode. The program aim is to provide useful and relevant elementary education for all children in the 6 to 14 age group by 2010. Universal Immunization Program UIP was launched in 1985, sponsored by central government, Ministry or Department of Health and Family Welfare. Immunization is one of the cost-effective interventions for disease prevention. Traditionally, the major thrust of immunization services has been the reduction of infant and child mortality. Immunization is an important mission for health promotion and therefore is a true national investment. Districts will provide equitable, efficient, and safe immunization services to all infants and pregnant women. Objectives of the mission are: contribute to global eradication of polio by 2007, elimination of neonatal tetanus, diphtheria, and pertussis by 2009, establish sufficient, sustainable, and accountable fund flow at all levels, ensure that there is sustained demand and reduced social barriers to access immunization services, strengthening coordination with national operational guidelines, supervision practices, and prioritizing poorly performing districts and underserved population. School Health Program under National Rural Health Mission has been launched to provide effective health care to the children. It is the only public sector program specially focused on school-age children. Its main focus is to address the health needs of children, both physical and mental, and it also provides nutritional interventions, sanitation, hygiene, counseling. Components of School Health Program: screening, healthcare, and referral. Immunization: micronutrient, vitamin A and iron folate tablets management, deworming, capacity building, monitoring and evaluation, midday meal. Nutritional programs. The various nutritional programs are in operation in India since first 5-year plan period. International agencies such as WHO, UNICEF, FAO, CARE are assisting the government in these programs of India to improve nutrition of the people with special emphasis on mother and children. These are specific missions established to eradicate malnutrition. Vitamin A Prophylaxis Program, launched by Ministry of Health and Family Welfare in 1970. Component: control of blindness. Beneficiary group: preschool children are administered orally with retinol palmitate 110 mg every 6 months for every preschool child above 1 year. Vitamin A deficiency increases the severity of mortality from measles and diarrhea. Balwadi Nutrition Program. This program was started in December 1970. It is under overall charge of the Department of Social Welfare. Beneficiary group 3 to 6 years. Visualizes on the provision of supplementary nutrition to the extent of 300 calories and 15 grams of protein during 250 days in a year for children attending Balwadi. Midday Meal Program. It was launched in 1957 in Tamil Nadu. Aim: 1/3 of the required food per day of the child be furnished through this program. Skimmed milk, banana, rice meals, egg are provided. Government of India has fixed the nutritional norm for primary children as 450 kilocalories and 12 grams of protein, and for upper primary as 700 kilocalories and 20 gram of protein. Thank you.